reopening process. We worked closely with superintendents across Arapahoe County, our other two counties, as well as counties across the metropolitan area. And at least initial feedback from schools is this guidance is going to be quite helpful to them. This guidance is in lieu of issuing a public health order. I think there remains some confusion that Tri-County is going to mandate what schools have to do. That's absolutely not the case. Certainly if things do not get substantially worse, we'll be working closely as a partner with our schools. We'll be using state guidance when it exists, but we'll be trying to use local context as much as possible. And I think the guidance that we developed and released today will allow the schools across the entire metro area to be more on the same page, singing off the same song sheet. They've all got different contexts, but I think it will allow them to work in a fairly consistent way with each other. Dirk mentioned new public health orders. They seem to come out on a regular basis. The order that came out last Friday was the 7th Amendment to Public Health Order 2028, if you're counting. And it did have some modifications. And honestly, even for me and Melissa Sager, who's our really expert on these topics, is on the call tonight, keeping up with what happens is challenging. And so for the average person in the community, it's really challenging. But what's happening incrementally is that things are being allowed to expand so that sporting events are allowed to be played with 25 players, both indoors and outdoors. That's a slight expansion. Gyms can have up to 50 people, excluding staff. Again, a minor modification, but a clarification. We've got some new indoor and outdoor events guidance where we're allowed to have 100 people per room indoors and 175 per designated activity outdoors. So there's a number of different twists. An important one, bars are allowed to open at 25% capacity. If you're the kind of person that likes to head down to your local bar, that is now open. Many bars have not opened because that's still a fairly small limit, but it is beginning to get that particular piece of our community opened back up. I want to close by mentioning one that I've been really anxious about, which is visiting to facilities where our seniors live, long-term care facilities, when we begin to have devastating outbreaks in March and April. Visitors were prohibited from visiting these facilities. Things have gotten a lot better inside the residential care facilities, better protective equipment, staff are better trained, they've got more access to testing. And so as of several days ago, the state did release guidance for residential care facility outdoor visitation. The facility has to be infection-free, no current outbreaks, nobody in quarantine. But if they can meet these criteria, they are allowed to open and accept visitors who will visit with their family member or loved one in an outdoor setting. So we're trying to, as you probably have heard the governor talk about, the great vast outdoors, which is a terrific place to congregate right now, as long as you're 6 feet apart, because the fresh air, the sunshine, the breezes make transmission much less likely. This order, like other orders, does not require Tri-County to approve it. There's been some initial confusion about that, but as long as a facility meets these criteria, they are allowed to open up and to accept visitors under carefully controlled circumstances. Thanks very much, then.
Dr. Douglas, thank you very much for your update. Now, if you're just joining us, a reminder, you can press *3 on your phone to speak with one of our operators and get your question in the queue for the evening. And now, we'd like to give an update on how we've made voting safer in time for the state primary on Tuesday. Here with us is clerk and recorder Joan Lopez.
Good evening. As Dirk just said, we have a state primary election this coming Tuesday, June 30th. Voting is underway, and we've already had a little over 90,000 voters return ballots. This is an exciting time for us. We have worked very hard in the past several months to develop and protect and make sure you're healthy and safe to vote. We want to make sure you have options to vote. talk about these steps a little further, I'd like to bring our Arapahoe County.
We just lose you, Joan?
Did you hear me?
Yeah, I've got you now, Joan.
Oh my goodness, where did you lose me through the whole thing?
Well, so we were just talking about little steps further, and you were, I believe, about to bring on Miss Pearl.
Oh, okay. Well, I just wanted to let everybody know that we've worked very hard in the past several months to develop plans to protect the health and safety of our voters, and we wanted to make sure that you all had options to vote. So I wanted to bring Peg Pearl on. She's our Arapahoe County Elections Director, and into this conversation, and I wanted her to go ahead and to go into further detail on this subject.
Thanks, Joan. We right now are in the middle of voting, and we have 3 different options still available for all voters to get their ballots in. Those ballots are due by 7 p.m. on this coming Tuesday, June 30th. So the first thing that you can do is return your voted ballot to any of our 24-hour drop boxes. We have 30 of them across the county, and they're all open now until 7 p.m. on Tuesday. You can find the list of those drop boxes closest to you on our website, arapahoevotes.com, and those 24-hour drop boxes are ready and waiting to take your ballot. The second thing you can do if you need a new ballot, a replacement ballot, perhaps something happened to yours or you made a mistake, you can actually call our office tomorrow or Monday or Tuesday. You can call 303-795-4511 between 7 a.m. and 4 p.m., and you can schedule a curbside pickup of a new ballot. At any of our 6 voter service centers across the county, you'll be able to set an appointment of a time. You can pull into a special marked parking spot, and we will bring a ballot out to you in your car. You can then vote the ballot in your car if you'd like, and turn it right into a ballot box, one of those 24-hour drop boxes that's already in the parking lot, or take it home. But again, remember to bring it back by 7 p.m. on Tuesday. So you can call tomorrow if you would like Saturday pickup. We are open Saturday for those curbside pickups as well from 9 a.m. to 1 p.m. And the final option you have is voting in person. And the best way to stay healthy while voting in person is to vote on our less busy days. So tomorrow, Friday, from 8 to 5, or Saturday from 9 a.m. to 1 p.m., or Monday on 8 to 5 are our less busy days. You can come to any of those 6 vote centers, and the directions are on our website, arapahoevotes.com. We will also be open on Election Day from 7 a.m. to 7 p.m., and we will indeed also be taking steps to keep everyone healthy and distanced by using those great outdoors Dr. Douglas talked about. And at our busiest locations, you'll see we have some tents with express voter services outside where you can get your ballot taken care of and vote while staying in the great outdoors. So we hope everybody gets their ballot in, and thank you for voting and for staying healthy at the same time. Thanks.
Thank you, Peg and Clerk Lopez. Now it's time to take some calls. As a quick reminder, you can dial *3 on your phone to get connected to an operator. And our first caller is Rebecca. It looks like got a question about an event and how many people can attend. So Melissa Sanger, this one is for you. Go ahead, Rebecca. You're live on the call.
Oh, hello. I think you kind of answered my question earlier about 100 people can be at an indoor event now. We wouldn't have anything close to that, but I was just concerned if we should have people wear a mask. We're trying to throw a bridal shower, maybe 25 people tops, and we were going to provide hand sanitizer and all that stuff, but we just wanted to know if we can have an event with about 25 people indoors, and it looks like you can have 100. So maybe I really don't have a question. I'm just worried about distancing in a smaller area with 25 people.
It's a really fantastic question, and I'm really happy you asked, especially with that 100-person limit, because I'll give you a caveat as you're planning. What the state has done is allowed indoor and outdoor events very generally to occur. So it would include your baby shower activities or bridal shower activities. But what we're looking for here is for you to look at your space and, just like you mentioned, exercise that social distancing. And so the state has provided a calculator that you can use for your space that you have to ensure that all of those folks can stay at least 6 feet apart. We do recommend that you hold these activities outdoors to the greatest extent possible. And we have some guidance on our website for small social gatherings like you're describing. This includes things like asking folks to bring their own chair so you have less touch surfaces. When you serve food, maybe have a picnic style where folks bring their own food. If you do serve food, making sure that people aren't using shared utensils and are able to stay far apart when they're getting their food and can take it back to their own area. And we really ask that you make it fun. It sounds silly to have a plan and send that plan to your close friends and family, but it's great to let your friends and family know how the event will go. Come around the back and use the fence, bring your own chair, stay 6 feet apart, wear your mask, very important, and you mentioned that. So whether folks bring their own mask or you have a couple on hand, and it sounds like you already have hand sanitizer. So I encourage you to visit our website for that guidance for these small social gatherings, really focusing on keeping people at least 6 feet apart, wearing those masks, and washing their hands or using hand sanitizer.
Thank you very much. We're going now to Mark in Aurora, who's got a question about masks. So I think, Dr. Douglas, this would be a good question for you to answer. Go ahead, Mark, with your question.
Hi. I drive for Uber. I've just recently started driving for Uber again since the pandemic. And Uber is requiring us to wear masks as well as the riders. But in the close confines of an automobile, we're much closer than suggested, and there's so many people in and out of that car every day. It really makes you wonder about your safety, even though we sanitize and sanitize and sanitize. People cough and sneeze, and I'm just a little bit curious about how safe I am with the masks that people are wearing.
So, Mark, good question. And folks like you, Uber drivers, cab drivers, are really essential, and we want to be sure you guys are able to be as safe as possible. I will acknowledge that the confines of a car are close. I would say in the summertime, if your passenger doesn't mind the window being cracked or down rather than the air conditioning on, you'll both be safer, because ventilation appears to make a big difference. To get to your real question about masks, they're really vital. They do appear to reduce transmission if you've got it from you to your passenger, if your passenger's got it from that person to you, by 50, 60, 70%. They're not perfect. They don't take the place of you doing the kind of sanitizing you've talked about and using hand sanitizer. But I do think the more that you can wear the mask and really insisting on your passenger wear the mask, if you both do it, then you've really doubled your value, or at least increased it substantially. So good ventilation, good sanitation, and do please wear the mask as consistently as you can.
Good advice, Doctor. Now, everyone on the call, this is the time that we're leaning on you to get some answers. We've got a poll question. We'd like to know how you're planning on voting this Tuesday, or maybe you've already voted. So press 1 if you're voting by mail or using one of our 24-hour drop boxes. Press 2 if you're using a voter service and polling center. Or press 3 if you've already voted. Again, we'd like to know how you're planning on voting this Tuesday, or maybe you've already voted. Press 1 if you're voting by mail or using one of our 24-hour drop boxes. Press 2 if you're using a voter service and polling center. Press 3 if you've already voted. Now back to the calls. We've got Eileen in Aurora joining us now with a question about churches. And I think, Melissa, Tri-County Health, this is a good question for you to answer. Eileen, go ahead with your question.
Yes, I'm a senior citizen, and I want to go to church, but we can only have 50 people in church, of course, wearing masks, safe distance. Is that so? We can't really go because that's a very, very small fraction of people. Is there any chance they're going to open it up and let more people be able to attend a church service?
Thanks for the question, Eileen, and it's one that we get a lot about places of worship, and we do understand how important these places are to the community. Like you said, places of worship can operate with 50 people currently. The state is focused on very gradual reopenings. So in this 7th amended order that we saw last Friday, the state added a space calculator to the guidance for churches that allow very large churches to increase their numbers up to 100 people. So this space calculator accounts for the space in which people can spread out. Again, very large spaces using this calculator. It's still best to keep those numbers small, especially for our vulnerable folks. And so what we're asking our places of worship to do is to continue offering those virtual services so we can get people engaged and keep those services going while keeping folks safe. Some churches are implementing hours for more vulnerable populations, older adults, to participate in worship services in person. But for now, keeping those groups small because it's a close, risky place for people to be gathering. But we are seeing gradual reopening, so I encourage you to keep an eye on the state orders, the Tri-County website, for updates as we move into new phases of reopening.
As a quick reminder, if you have a question you want to ask in tonight's call, please press star 3 on your telephone keypad. Again, press star 3 to enter the question queue. Now we've got Estella and Aurora joining us on the call, and you're talking about having no symptoms, wondering about the testing. Dr. Douglas, please listen to this question from Estella.
Yes, my church is having testing on Saturday, and I'm wondering if you have absolutely no symptoms at all, should you take the test?
Good question, because as our testing capacity, Estella, has gotten greater, we've got the opportunity for not just the really sick people or even the mildly sick people to get tested, but in some circumstances for people that are purely asymptomatic. You know, I'd say it would all depend on your context and how you envision using the information. If you work in a facility, if you're a healthcare worker, you work particularly in a nursing home, I think that sort of testing can be useful because those are circumstances where transmission to really vulnerable people can happen. If you are planning to go visit a vulnerable relative and you want to take an extra step to be sure that even though you've been careful that you're not infected, that could be another scenario where that sort of testing could be useful to you. I'd say that as a general matter, though, if you feel great, simply testing yourself probably doesn't give you a lot of what I would consider to be actionable information, meaning if you've been careful, if you test, if you're positive, you do need to isolate yourself. That's really going to be an important thing. But if you're negative, it doesn't mean you couldn't get infected tomorrow if you go to the grocery store and you forget your mask. So I think it's a kind of a related to your individual circumstance that would allow you to make the best choice about that.
So earlier today, I learned about something, and I think it should be shared. Arapahoe Cares is the county's COVID relief program. You know, it's funded with $114.5 million in federal grant money that will go toward helping the county's residents, businesses, and communities to recover from the COVID crisis. For more information about the many programs we're establishing with these funds, go ahead and visit arapahoegov.com/Arapahoe Cares. And now back to the phones. We've got Bill from Aurora wanting to talk about libraries. Melissa, will you listen to Bill's question? Go ahead, Bill.
Hi, Melissa. I'm wondering when the libraries are going to be open. We haven't heard a whole lot about that.
Thanks so much for the question and calling in. We just got word from the state that libraries can operate under the new indoor event guidance. And so we are working actually to communicate out to our libraries this evening to let them know that the state interpreted the order to allow them to do this activity. I will say, and I've mentioned the new social distancing space calculator that the state released. This calculator must be used by libraries to operate, and we're finding it very restrictive in these indoor spaces that may be a bit smaller. So we are working with the state as well as the libraries and our local governments to find a fix to allow these establishments to open more broadly. But we do expect the establishments to begin very gradual reopening in the coming days and weeks. So keep an eye on your library's main page for updates, as well as reaching out to Tri-County for those updates as well.
Thank you, Melissa, and stay where you are. The next question's coming to you, too. Just a quick reminder, if you have a question you want to ask on this call, please press *3 on your telephone keypad to enter the question queue. Again, if you've got a question, press *3. And Martin in Englewood is joining us, wants to talk about throwing a birthday party for his mom. Go ahead, Martin.
Right. Got a 100-year-old birthday party coming up in 2 weeks, and Mom, who's in a assisted living in Greenwood Village, and we were wondering if it's safe. They've got a nice patio to have 10 or 15 people socially distanced on the patio and have cake and ice cream and play the guitar and whatever. The building director has said no more than 2 people, and that seems very restrictive outdoors.
Thank you so much for the question. And first, happy birthday to your mom. That's really lovely news to hear, and so thank you for sharing that. Dr. Douglas referenced new guidance from the state just this week regarding visitation in residential care facilities. So the new guidance does say that you can visit in an outdoor space at these facilities, that you can have groups up to 8 people, and so that's a little smaller than what you were describing, but having folks maybe rotate for their visit, still keeping your 6-foot distance and wearing your mask, of course, but that those activities are beginning to happen. It will depend on the facility that you're visiting, because facilities are so unique, both with their residents that live there and the space in which they're operating. They will be creating rules based on those facilities. And so it may be that the facility where your mom lives may be 2 people for some time, in which case we'd ask you to rotate in those smaller groups. Again, just depending on what they're experiencing there. But if these long-term care facilities have questions, this guidance is very new, and so we'd encourage those facilities to reach out. We'd be happy to chat through the new guidance as well as the requirements and how to keep folks safe. So do reach out, encourage others to do the same as we implement this very new guidance.
So a quick time check. We're about halfway through tonight's telephone town hall discussion with Tri-County Health. Now, we've already had some great questions, and we've got a lot more lined up. But if you'd like to ask a question, simply press *3 on your telephone keypad to speak with an operator. Now, we're going to the web for our next question. Dr. Douglas, this is for you. EA asks, what is the safety of dental or eye doctor appointments given COVID-19 is spread through the nose, mouth, and eyes?
Yeah, so that's a really good question. For a long while, dental and eye doctors were closed down. They were considered elective. They've opened back up now. you obviously can't wear a mask if you're seeing a dentist, but the dentist ought to be masked up with personal protective equipment. At least at this point, we are not aware of shortages in practices, in dental practices in general. Early on, when they opened up, there were some issues, and they frankly couldn't open back up. I think if they're open now and they're following the guidelines, particularly they're wearing personal protective equipment, which protects them, but it also protects you, that ought to be sufficient and ought to be safe for you to receive services. I'd say the same thing about visiting an eye doctor. You are correct that splashes to the eyes of infected material could be infectious. That's why people doing invasive procedures in hospitals wear face shields, for example. But in general, if the provider is adequately masked and wearing other protective equipment such as gloves, you ought to feel quite safe in going and making your visit.
Thank you for that answer, Doctor. And stick around. Pamela's joining us right now, and she's got a question for visiting senior citizens. So, Pamela, welcome to the call. Please ask your question of the doctor.
Oh, thank you so much for allowing me to do this. My oldest sister, she's 79. She's got serious health issues, COPD and emphysema, and she has some church friends who want to come and visit. I do have a patio that they could visit on, but she's on oxygen 24/7. I would presume that she would still need to wear a face mask, and also her visitors would also have to do that. And is there anything else that I need to take extra precaution with here?
So, really important question. And first of all, it's great that your sister's got an opportunity to be visited by her friends. And so I think having that happen in an outdoor space such as a patio is a great idea. The support that could provide her, I'm sure, will be good for her health and general well-being. So a couple things. Your visitors should definitely wear a mask. They shouldn't come if they're feeling sick or if they've actually been around anybody who's been sick. Everybody ought to be really careful about hand washing, the kind of things Melissa talked about earlier. The guest and you and your sister, if you're part of the visit, ought to be washing your hands and both before and after the visit. And they ought to stay 6 feet apart from her. Even with the mask, we think that extra distance provides value. But I think in that sort of setting, if they are masked, she ought to be quite safe. Most people who require oxygen and have a nasal cannula really can't wear a mask. You could, try it as trial and error. If she could tolerate it, it won't be a perfect protection with a tube going out the side, but it might provide some benefit. And I think that would be an added security. But the main thing, again, is the distancing, the friends wearing a mask, doing it outdoors, and good hand sanitizer.
Thank you, Dr. Douglas. Now, our next question pertains to voting, so I think, Peg Pearl, this one's for you. Stella on Facebook asks, do I have to make an appointment to vote at a polling center?
Thank you. Good question, Stella. No, if you just want to come in and vote at one of our 6 voting service and polling centers across the county, you do not have to make an appointment for that. We are open from 8 a.m. to 5 p.m. on Friday and Monday, and a little bit longer, 7 to 7 on Tuesday, and then those special Saturday hours, 9 to 1. You can just show up and vote. The appointments are if you would like to do the curbside pickup where you don't have to get out of your car. So if you would like a ballot brought out to you in your car, those are the only times that you would need to call our phone number and make an appointment. Otherwise, just check our website, arapahoevotes.com, and you can see which voting center is closest to you and come during the open hours. Thanks.
Thank you for that succinct answer. So next up, we've got Michael with a question for Dr. Douglas. Go ahead, Michael. You're live on the call.
Yes, Dr. Douglas, you had mentioned that there was a document that had been created for school recommendations that was released today. Is that being distributed to all the private schools also, or is that more of something that went to the public school systems?
Well, we developed it. Oh, sorry, go ahead.
Well, I was going to say, if it hasn't, is there a way to get copies of it?
Yeah, we've got it on the currently embedded on the website of the Colorado Health Institute, who mans the website of the Metro Denver Partnership for Health. And I will try to pull that website up and give it to you. I don't keep it on top of mind. It was developed with public schools in mind and with the collaboration of public school superintendents, but we absolutely think it's potentially relevant for any kind of school-based settings, including private schools. So it's certainly open to anyone who could find it useful, including private schools.
Thank you again, Doctor. And as a reminder, Arapahoe County has begun reopening county facilities to the public. Now, most services are being offered by appointment only. So you need to do business with the county, it's best to check the website first. Visit arapahoegov.com/COVID-19 to see what facilities are open and how you can easily make an appointment. Now let's get back to more questions. And this one, Ms. Lopez, I think will come right to you. We've got Jeanette on the line. Go ahead, Jeanette. You want to talk about license plates?
I do. I just realized that the grace period for renewing my license plate tags expires on Tuesday the 30th. Normally, I just go over to the Arapahoe Motor Vehicle office on Lima and renew them with my, the renewal card that you get. And when I was just told that I need to make an appointment to renew those tags.
Janet, thank you. Well, thank you for your question, first and foremost. I know that a lot of people are concerned about being legal driving around with their car registration being expired. Just so you know, in the last town hall that I was in, Sheriff Brown has made it clear that he is not giving out tickets, making sure that his officers aren't giving out tickets due to the fact that we have communicated with him about our closure. As far as your grace period, you're meaning that your tags expired in May, or you're past your grace period after June. Is that correct?
So we've already moved on here. I would presume that she's mentioning that she's reached her grace period termination. It's over with. So she's reached that time in which the tags will be expired.
There's also other options besides making an appointment. We have several kiosk locations, and they are located in King Soopers and also AAA offices. So if she could go online and look at those locations, she can actually get her tags through a kiosk. She could also drop it off, and we'll mail it directly to her right away without the appointment. And she can drop it off directly at the Centennial office. So there's other options that she can do as far as renewing her tags. And again, I wouldn't be concerned about Sheriff Brown giving any tickets about being expired on plates.
Thank you for answering that question, Ms. Lopez. Moving on, we've got Jonathan joining us. Talk about youth sports activities. So, Melissa, this one's for you. Jonathan, what is your question?
I have a question regarding youth sports, primarily baseball, softball, in a tournament environment. That's one thing in the current set of guidelines that was specifically excluded from being able to happen, and if that's going to change with this next set of guidelines, or will it follow the general 175 people outdoor event?
Thanks, Jonathan. That's a really great question, and maybe one that I have good news on. So in this latest order, the 7th amended Public Health Order 2028, the state removed the prohibition on tournaments. With that, I'll say that we are still looking to keep gathering sizes very small, and so limiting the number of spectators at those events, having folks wait in their vehicle before their game as opposed to on the field, only 25 kids per field still, and so still keeping those numbers very small, but allowing tournaments to occur so long as that social distancing is adhered to. The state does recommend limiting the number of games because the more games you play, the more different folks you have a chance of coming in contact with. And so allowing that activity but balancing it with these safety protections and just entering into it with some caution that they are allowed.
Thank you, Melissa. Next up, we've got Sandra from Aurora joining us, concerned about the number of people testing positive and those numbers going up. Dr. Douglas, this is a good question to listen to. Sandra, go ahead with your question.
Thank you. Thank you all for letting us call in. So I was wondering, because the numbers seem to keep rising as far as those testing positive again with the big wave of opening up, and how is that going to impact people still opening up more and more? And, you know, obviously they're not using the safety precautions, or maybe everything is just too soon. I'm just wondering how that's going to impact further county offices and a lot of public places opening up.
So, Sandra, that's the $64 or maybe $64 million question. It's a really critical one. When you hear Melissa talk about we're trying to, limit the number of people, or you should stay in your car until your baseball game or whatever, it's all around finding a balance. We do want our businesses, our sports tournaments, our churches, et cetera, to open back up, but we want it to do so safely. So we are super carefully monitoring various measures of potential virus transmission. If they start to begin to head in the wrong direction, we'll be looking for ways we could try to address that. A number of governors across the country, for example, have instituted statewide requirements to wear masks. We don't have that here. That's an idea that could come up. We really don't want to see some of the entities that have waited so long to be opening back up have to wait or to go backwards. And that's why the carefulness is so important. But honestly, the Texas governor just said today, hey, we're going to have to slow down our reopening for precisely the reason that you point to. So we're really hopeful that our good data, our good trends, and they are relatively flat, will continue, because we are being, I think, really very cautious and very deliberate, even though it's slower than a lot of people would like. And I think if we can supplement that really with care, those of us that are vulnerable, staying apart from other people, others wearing masks, using good hand hygiene, remaining socially distanced in public, I think we've got a chance, but we got to really be careful. So fantastic question, and something I think we've all got to think about. Probably the biggest take-home of the call tonight. If I could, Dirk, I do have that website of our guidance for schools that Michael asked about, coloradohealthinstitute.org/research/Metro Denver Partnership for Health. It's really a mouthful, but you can find it. I just look for it.
All right. Thank you very much for finding that information, Doctor. And as a reminder, if you have a question you want to ask, please press *3 on your telephone keypad. Again, *3 will get you into the question queue. Now, Melissa, this next question comes to you. We've got Mary from Aurora who's eyeing a refreshing dip in her community pool. Go ahead, Mary, with your question.
Thank you, and thank you, Arapahoe, for having library services available. I live in an HOA. We have 2 pools here. We have published all of the statistics on the challenges of opening pools at this time. What are the latest guidelines from Arapahoe County on community pools?
Thanks for the question. The state has issued guidance on pools, specifically outdoor swimming pools. The concern in this space isn't so much with the water itself. It's more about the ability to keep that distance while you're swimming, especially since you can't wear a mask in a pool. So the current guidance is 50% capacity, up to 50 people. This is excluding lifeguards, other staff. The pools are encouraged to have a reservation system. So your ability to go to the pool looks a bit different than it has been. It'll probably include a time limit so that they can tightly control who's there and where, probably an assigned spot where you'll walk to, so that folks can clean that commonly touched surfaces off in between guests and control that number of people visiting. But we are seeing our pools gradually reopen, and so check your local pool for more information, but they can they can reopen with that 50% capacity up to 50 people.
Thank you for that answer, Melissa. Next, we're going to an online question, and Dr. Douglas, this is for you. Jennifer states, for July 4th, she's going up in the mountains to stay at their house. Her parents are considered high risk. She has no symptoms, but would like to get a COVID test just to be safe. So if she has no symptoms, can she get tested and where?
Yeah, Jennifer, a good question. And as said earlier, because we've got more testing, we've got more chances for folks that are feeling fine but want to be on the safe side to be tested. On our website, I don't know where you live, but we've listed a number of different places across all three of our counties, including Arapahoe County, where you can be tested. Many physicians, if you have a regular primary care provider, are part of networks that are also doing testing. So it's not everywhere yet, but it's getting more and more widespread. Just be aware that if you test negative, that means very, very low chance that you've got an infection, but you still want to be careful around your vulnerable parents in terms of distancing, hand hygiene, and ideally when you're indoors, even if your test was recently negative, I'd still lean toward the use of a mask just to add the protection.
Thank you, Dr. Douglas. And we've got Debbie joining us from Aurora. And Doctor, I think this is another question for you. So Debbie, go ahead with your question, please.
Hi, Dr. Douglas. Thank you for taking my call. I suspect that I had COVID early on in the pandemic, but I was never tested because I didn't have a fever. And now that they have the antibody test out, I'm considering taking that, and I would like to know if there's any benefit to me to taking that test other than satisfying my own curiosity.
Debbie, a lot of people are asking that question. I think the primary benefit, honestly, at this point is curiosity satisfaction. We believe that somebody who's had the infection probably will be at least partially immune to getting reinfected for at least some period of time, but we don't know how much partial immunity means. I mean, it could be 100%, it could be 75, it could be 50, and we don't know how long it lasts. We do know that with the common cold caused by coronavirus, is sort of a first cousin of the COVID virus, that immunity may only last 6 to 9 months or so. So I think you would likely conclude from it, if you were within, let's say, 6 months, oh, I've satisfied my curiosity, I did have it, and I probably am at somewhat reduced risk, but I shouldn't throw caution to the winds. I still need to be careful because I could get it again.
Next up, we've got an election question from Jack. And fortunately for you, Jack, we've got Elections Director Peg Pearl on the line. So go ahead with your question for Ms. Pearl.
Hi, this is Jack. I noticed that when I got my ballot from Arapahoe County, it showed a drop-off box in the town of Bennett. When we're ready to drop my ballots off, the box is marked Adams County. Asking a whole bunch of people, they finally decided that it's still okay to put your ballot in the Adams County box. It would still count. We need to make that a little more clear for the rest of the public.
Thanks, Jack, for your comment. Yeah, because of our partnership with Adams County and the way that our counties border each other, we have a number of boxes, not only out there in Bennett, but also in Aurora and a few other places that we have listed for both Adams County and Arapahoe County voters. And we try to make that clear on the box itself, but I take your feedback important, and I will make sure that it's even more clear on the boxes. So certainly you can put your ballot in that box, and it will come to the right county. We switch ballots back and forth between Adams County and Arapahoe County a number of times during this season. And honestly, if you're a Arapahoe County voter and you find yourself with your ballot accidentally still in your bag and you're stuck in the mountains on Tuesday and you need to turn that in, you can actually put it into any county's drop box by 7 p.m. on Election Day. And we all have an agreement that it's received at 7 p.m. by one county. They stamp it as received, and then they hand it over to the proper county. So we will get that here in Arapahoe County, and it will still be processed and counted. But I thank you for that feedback on our signage, and we're always looking to make it even more clear.
Thank you very much, ma'am. And just to repeat a web address that was given out earlier for that very fresh information on schools, this is the address you can use: coloradohealthinstitute.org, and scroll down to the In the News section. So again, for that very current information on schools, you can find the information at coloradohealthinstitute.org and scroll down to the In the News section. All right. So next up, Dr. Douglas, we've got Margaret from Arapahoe County joining us, and she's got a question for you. Go ahead, Margaret. What's your question?
Yes, my son has Down syndrome and autism, and he's an adult. And I know that has been recognized in articles that they're an at-risk group, but I don't ever see that noted is one thing. But my question is, he's going to be heading back to his day program for some on-site programming inside, and they had heard that face shields would be allowed, and I wondered if they're as safe as a mask.
Margaret, really, important question. Thank you. In all honesty, there's not been any direct device-to-device testing to really say definitively yes it is or no it's not. I'd say that everything we know about the particle dispersion and particle physics would suggest it's not as safe. The face masks and face shields were designed to protect eyes. They're really not going to protect the mouth and the nose as well. It is probably better than having nothing at all, but a mask that actually fits over the mouth and nose is very, very likely to be safer than the face shield.
And Doctor, we're continuing on the school theme. We've got Marilyn joining us from Centennial, and she's got a classroom question for you. Go ahead, Marilyn. What's your question?
Hi, thank you for taking my call. My question has to do about going back to work. I am 67 years old. I am a special ed paraeducator for the Cherry Creek School District. I've been working there for 12 years, and I love my job and the kids that I support. But on the flip side, I am concerned about going back into the classroom. Last we heard from Dr. Siegfried, we were going to have the students in the building 5 days a week. So that will be 20-plus students in a classroom. I don't think it's possible to be 6 feet apart, and I'm not sure if the students are going to be required to wear masks. So do I take the chance and go back to work? I don't want to get the virus, and I don't want to bring it home to my 67-year-old husband who has survived a major heart attack and had quadruple bypass. And I'm just agonizing over this decision.
Marilyn, it is an agonizing decision. I really empathize with the situation you find yourself in. We've been working really closely with Superintendent Siegfried about what's going to be happening in the classroom. He does want to have students back as fully as possible. The guidance that I referred to earlier does strongly endorse and encourage the use of face masks whenever possible. There will be some kids who can't wear them. We do think there are kids who, and maybe all kids need to kind of get a mask break. But honestly, even when you mandate a mask, you can't make everybody wear it all the time. And so I think there's clearly going to be risk in the classroom. We've given them a list of folks, staff and teachers that they ought to be particularly careful about in terms of could they work remotely or could they serve the school in some other way. And frankly, you're in the age group that I would be more concerned about. And now that you tell me your husband's got a cardiac history, I'd be yet concerned further. So I guess I would say stay tuned. The story could change. But right now, I would be concerned about your being in that situation.
Thank you, Doctor. Now we're moving on to a online question from Laura. Melissa, this one is for you to answer. Laura has friends with a graduation party coming up and other fairly large gatherings. Is the 10-person limit still the guidance? We've been strict about it with her family, but people around us are hosting a lot of big parties.
It's a really great question, and one that I'm happy to provide an update on. This touches on the new state guidance that allows outdoor and indoor events more generally to occur. It does let folks exceed that 10-person limit, but there is very strict restrictions on the number of folks that you can gather with, depending on the size of the venue that you will be in. So if you're in your backyard, that number looks very small. If you're in a very large open facility like your park and a pavilion and you can spread out, that's what we want to see in these situations, spread out very far. And I mentioned our practical guidance for small social gatherings. So even in these spaces with the largest space that you could have, you can only have up to 100 people indoors, 175 outdoors. But we have practical guidance on those smaller gatherings, like not having shared games, putting signs up, and having a plan for those events. So it really depends on your space that you're working in and what kind of activities you have planned. But please reach out to the Tri-County Health Department. Our Business Reopening Task Force can connect you with great resources. They can be reached at covidbusinessrecovery@tchd.org.
Thank you very much, Melissa. And I'm being told we need to begin to wrap up this call, so we have time for just one more question. Dr. Douglas, this one's for you from Michelle in Aurora. Go ahead with your question, Michelle.
Thank you for taking my call. I am going to go in for surgery on July 7th. I'm having foot surgery over at Lutheran Medical Center. Even though I'm in Arapahoe County, I have to go to Lutheran Medical Center because of my insurance. But I'm concerned when I take my COVID-19 test that if I do test positive, that I will have to postpone that, and will I have to be isolated, and what exactly may happen because of that, because that's a definite thing that I have to do for the surgery. It's kind of a repeat surgery because they put plates in the first time, and now I'm not reacting very well to the plates that are in my foot, so they have to just take them out.
Yeah, so thank you for that question. I would say that if you do test positive, it's probably not going to be up to you as to whether to postpone the surgery. I'm assuming they're asking you to do a pre-op test, and they do that to try to enhance infection controls in hospitals. And if you test positive, they're going to say, sorry, we really do have to cancel. The general guidance is if you're feeling fine and you have a test, like some of the tests that some of the other people have asked about tonight, you're an asymptomatic person, is that you need to be in isolation for 10 days. And what that means is to be sequestered away from other people so they don't come into contact with you. So, yes, you would need to postpone it, and you would need to be in isolation. I hope you test negative so you can go ahead and get your foot fixed.
Thank you for that answer, Doctor. Everyone on the call, we've enjoyed this time with you tonight, and we hope that you have found it useful. And before we leave, we'd like to bring our county commissioners on the line to wrap things up for us. First, we have Commissioner Nancy Jackson.
Thank you, Dirk, and thank all of you for joining us. As you've seen tonight, reopening our communities and businesses makes some things clearer in some ways and more complicated in other ways. So we hope that you've been able to answer your questions, and we look forward to hearing from you again. We will be doing these more often now. So next, Commissioner Baker, I think you have some words for the group.
Thank you, Commissioner Jackson. We're pleased that so many of you could have joined us tonight
and we urge you to keep asking about any concerns or uncertainties that you might still have. In many ways, we're now at a key point in this crisis. So we encourage you to remain mindful of safe health and hygiene practices as you return to work or venture out into your communities. I'd like to introduce Commissioner Bill Holmes.
Thank you, Commissioner Baker. And thanks to our moderators, our experts, and to all of you for making this such an informative event. Our primary goals are to get our economy running again while still protecting our family, colleagues, friends, and neighbors. So please do heed this advice and let us know if anything is still unclear. I'd like to introduce Commissioner Conte.
Commissioner Conte, is your line muted? Looks like Commissioner might have been called away. So thank you to all the commissioners, and thank you to everyone for joining us tonight. We want you to be well, and as a reminder, we will post a copy of this recording to our website in the next 24 hours. Have a great evening.